Good morning. Welcome to Penn State College of Medicine's COVID-19 Echo Series. We're delighted to have you join us for this morning's session. My name is Ellie, and I'm a member of the Echo team, and will be facilitating in Jackie's place today. A few announcements before we begin. If you've not already done so, please put your name, email address, and affiliation in the chat function for our record keeping. Please stay muted unless you are speaking. You can press *6 or the mic icon in the bottom left-hand side of your screen to mute yourself. You can also use chat for communicating throughout today's session. We realize that question and answer time is very important to you, and we're trying to categorize and address as many questions as possible here, but we'll follow up with any open items after the session. If you have suggestions for future COVID-19 ECHO topics, please feel free to share those via the chat tool or email us at echo@psu.edu. Please remember that no personally identifiable information is permitted when discussing cases. We are recording these sessions, and we will share all materials and recordings after the session. I'll place a link towards the end of this session with access to that public folder. In the spirit of all teach, all learn, we will be on a first name basis during today's session. Our ECHO sessions will always begin with a brief lecture and are either followed by a case discussion or question and answer. Cases can include a question or challenge you want to address and are a critical component of the ECHO model. We encourage you to submit cases which can be related to patients, preparedness, policy, or whatever challenge you would like to discuss or generate ideas. The link to submit a case will also be included in follow-up emails from today's session. Today's session will include a brief lecture and case discussion on lessons learned and, on the impact of COVID-19 on children. This will be followed by a question and answer period. During the lecture, please feel free to put your questions into the chat. We have a team of specialists from Penn State online, and they will help you field questions. But remember, this is all teach, all learn, so everyone can share both questions and answers. We will pause between the brief lecture and the case to address questions. And with that, I'm going to turn things over to Katie Shedlock.
Hi, good morning. Thank you everyone for joining us today. I'm really excited to give this talk because there have been a lot of questions that have come up recently regarding children and how the pandemic has affected them and how COVID-19 as an illness has affected them as well. I am a pediatrician and I'm also a mother of 3 little ones. So some of this is coming from the pediatric knowledge, and some of this is coming from personal experience, and I'm happy to answer any questions that you have at the end or during the lecture if you have a pressing question. I'd like to point out that this lecture was designed for both healthcare professionals and for the community members as well. So you may be listening as a parent, a grandparent, a teacher, or some other caregiver, or someone in healthcare who interacts with children. So I'm trying to keep the medical jargon light and trying to focus less on the disease itself and more on how our children or our family units have been impacted in various ways by school closings, closing of businesses, and social distancing. So learning objectives today, by the end of the session, I'm hoping that you will understand the varied nature of COVID-19 symptoms in children and how illness severity is usually mild, be familiar with ways COVID-19 has changed pediatric healthcare, and be able to discuss the potential mind and body impact of the pandemic on children and how to help them stay happy and healthy. I want to start by talking about the symptoms and the hospitalization rates of COVID-19. Predominantly, children get fever, cough, and shortness of breath. And these are the children that have tested positive, of course, because those are the ones that we've been able to study primarily. But children can also have other symptoms. There's a whole range from nasal congestion, sore throat, nausea, vomiting, fatigue, headaches, muscle aches, and poor feeding. And so this makes it challenging because a lot of these symptoms also go along with other viruses. This is a table from a study done by Shen, which was a study of over 2,000 pediatric patients who were positive for COVID-19 in China. And it basically breaks up those children into different categories, whether they were asymptomatic, not showing symptoms at all, maybe were tested because of exposure, all the way to critical patients who had respiratory failure. And so the mild cases might have just fever, fatigue, cough, but overall doing fairly well. Moderate children may have pneumonia. Severe cases involve low oxygen saturation, and critical cases involve potentially intubation, respiratory failure. So you can see that the asymptomatic cases make up 4% in this study. In terms of mild cases, this is the largest category of 51%, and then moderate cases of 39%, severe only 5%, and critical only less than 1%. So primarily in the children they studied, it was mild in terms of their illness severity. And this next slide shows a relationship between, or comparison between adults and children in the COVID-19 positive category of patients that were studied in the United States. And this is put out by cdc.gov, which is a good resource if you're curious about what the current numbers are and comparison and what we found so far. So for the patients that were COVID-19 positive in adults, 93% of those had at least one of these: fever, cough, or shortness of breath. So those predominant symptoms. But for children, only 73% had at least one of those symptoms. And if we studied more children who were asymptomatic and did more testing, we'd probably find that, of course, there's lots of asymptomatic cases out there. So this percentage would have gone down if that was the case. But you can compare adults and kids and show that in general, kids may not have those predominant symptoms as often. And so this population was from February 12th to April 2nd in terms of the cases that were picked up in the United States. So included all 149,000 COVID-19 positive cases, and only 1.7% of those cases in the US were children. And so they were a small number, and they were also hospitalized much less compared to adults. And then they took the population of kids that were less than 1 year old, so the infants, and they saw that there were 95 children that were less than 1 year old and hospitalized. Only 5 of those required admission to the ICU. So the number of kids hospitalized and the number of kids admitted to the ICU was pretty small. But they did find that the children that were under age 1 and those that had underlying conditions such as chronic lung disease, including asthma, cardiovascular disease, and immunosuppression, were the ones that were highest risk. And then there was an email from the American Academy of Pediatrics that just came out yesterday that actually showed that Children's National is putting out data that is showing that a population of kids that were positive, so all of their kids that were positive, 105 that were sick with COVID-19, 27% of those required hospitalization. So it was kind of a higher number than they expected that actually needed to be hospitalized. And then a quarter of those that were hospitalized actually required ICU care. 70% of those that were in the hospital had an underlying condition. So just to kind of, I know that's kind of a lot of information and a lot of it is still unknown, but their take-home points is that having an underlying condition for a child increases their risk of being hospitalized with COVID-19 and needing ICU care. And they also were curious if children might be getting sicker in the DC area compared to the West Coast, which may actually have to do with which strains of the virus were coming from what part of the world. And so more research needs to be done on that specifically, but some interesting points for further research to come. So I found this quote in that article as well, and that was from the Washington Post, which represented the Children's National Medical Center to bring forth that data. But the professor of pediatrics who was quoted in this article stated, and I thought this was an interesting quote, "I think the one thing we would all agree on in pediatrics is the impact on children has not been emphasized enough. If mortality is your metric, thank God we don't see that in kids, but we do see disease." And I will note that there have been a few cases of pediatric deaths from COVID-19, but I know that further information is forthcoming regarding that. But there have been a few, but fortunately not very many. So I want to switch gears a little bit and talk about the impact on pediatric healthcare, and this will be fairly brief. But we do know that there's been lots of changes in our offices and our hospitals due to COVID-19. And these are just a few of the things. So obviously we've had lots of canceled elective surgeries and procedures. So children waiting for ear tubes, tonsillectomies, other procedures, those are being held right now. Emphasis on telehealth has become a very big thing, and that can be done in the inpatient and outpatient worlds. There's been lots of changes to the office procedures. So I know each office does things a little bit differently, but here at Penn State, we are actually eliminating the waiting room. So we are actually checking patients in from their cars. So they call us when they arrive. We tell them which room they're going to. When the room's ready, they go right back to the room. And then after the visit, they go right back out to their car, and we call them with information regarding scheduling and other items that they may need information on for checkout purposes. And so we're not exposing our patients to each other nearly as often. And we also have extensive screening prior to the visit. So we're calling every patient asking, have you been exposed to COVID-19? Have you been sick with it? And then have you done any traveling and those type of things? And so we can kind of screen that so we're aware of the situation, and we do a lot of telehealth appointments from those screenings to ensure that we are not bringing in patients that don't need to be brought into the office. And then of course, decreased ED visits are occurring because, for one, we're doing lots of social distancing. So our kids are not getting nearly as sick or as often because they're not around their friends in the school where they're picking up lots of viruses. And then unfortunately, a lot of parents are worried about going into the ER because of exposure. And we're trying to encourage parents, if you think this is medical emergency, you absolutely should go. So that's an important thing that we've been pushing. We've seen a reduced number of well visits, of course, but we are focusing on the younger children, especially to ensure that they're getting their vaccinations, which I'll talk about a little bit more in detail in a minute. And then the financial burden on hospitals and offices is something that we're definitely starting to see. And you may see some offices that just can't withstand the financial burden of the decreased number of patients. And you may see less offices after the pandemic is done. So we want to focus now on the delay in vaccinations, because this is a really important topic right now in pediatrics. For one, our delayed vaccinations could lead to another problem we could have after the pandemic, after all the sacrifices we've made and all the hard work we've made during this time. We may end up seeing an epidemic of measles, for example, or other illness. And so there's a strong need to start preparing for that now, getting your children vaccinated, keeping your children up to date with their vaccine schedule. And then if you work in an office, making sure that you're tracking those children that maybe missed their well child visits because they're worried about coming in or other reasons, but making sure that we're tracking them and reaching out to families and getting them vaccinated before this, before the opening of the businesses occurs and the opening of schools, and now they're back together. And then I would also point out too, let's try to do this before the COVID-19 vaccine is available. It's going to be a while down the road, but let's get all the other vaccines up to date so that when that vaccine is available, we're sort of, focusing on that too. And we don't have to worry about potentially, because I think a lot of parents might have some hesitancy about giving a new vaccine with the other ones too. So just important to update those vaccines as much as possible. So I want to switch gears one more time and talk about the third section of our talk, which is psychosocial and physical effects on children at home. And I think of this as a spectrum. So we can think of sort of maybe three general categories, and not every child is going to be distinct into a specific category, but each child is going to experience this pandemic very differently. And so you can have children that are in maybe a tough home situation, maybe burdened by loss of parents' jobs, not able to have enough food on the table. Maybe there's domestic violence or child abuse at home, really, really terrible things. They may be on the far left side of the spectrum where they're very negatively impacted. And then you may have children who are sort of in the middle, minimally changed, they miss school, they miss their friends, but they're happy to be at home with their families, they're getting their schoolwork done and sort of just living regular life. Then there may be children that are very positively impacted by this. Maybe school was this huge stressor for them, and maybe they're happy to be at home learning new skills and spending time with family. So I think of it in a lot of different ways and on the spectrum. So I want to focus now on the left side of this and really focus on maybe some things that we want to think about for our patients and our families that could be going on at home. There's a couple, just some things I'll go into more detail about that maybe aren't as important. So maybe small amount of weight gain because they're snacking all the time. There's lots of education disruption right now. So maybe their SAT had to be moved to a different date, things like that, but there's disruptions there, the delayed vaccines, the potential anxiety, mental health effects that come from it can impact kids. And then maybe there was a trauma that happened while they were at home or things like that that may impact them. So these are some things to think about. And then the right side, this is the positive end. So kids are maybe bonding better with their families. Maybe they're better connected with their grandparents because they're finally able to connect digitally with their grandparents who live far away, and maybe they learned new skills, how to cook. I encourage parents right now, try to think of something that you normally wouldn't feel like you had time to do. Teach your teenager how to budget. Try to teach your kids how to cook and how to be safe in the kitchen, and maybe even how to do laundry and how to ride a bike. Try to think of something that you can do during this time that is an accomplishment. And then maybe kids will have more of an appreciation for school and their teachers. I think that's going to be huge. And I know that as parents, we're all appreciating our teachers much more. So there is that to come out of this as well. So parenting in a pandemic is not easy. Nobody's great at this. I know a lot of families are stressed because they feel like they're not doing a good job. Maybe they're balancing work and taking care of their kids at home, but I'm telling families, just do your best. This is hopefully just a short time in our whole lives, and we can get through it together, and we just have to do our best. I want families to keep structure during the day as much as possible, especially during weekdays, during the week. So, doing their schoolwork, waking up at a reasonable time, eating 3 meals a day like they normally would. And that, I think that really helps overall. But then maybe let weekend days be weekend days. Let kids maybe sleep in a little bit longer and wear their PJs longer, and let them sort of have that difference between the weekend and the weekdays. Make sure that we keep a good nighttime routine. So maybe that's going to bed at the same time and making sure that we're brushing our teeth and reading books like we normally do. And then set limits on screen time. This has been a big topic that I'll expand on in a little bit, but a lot of parents are worried that the kids are getting more screen time. And I say set limits, but be reasonable that we're in a different time of life right now. This is a new normal. So I'm not stressing the absolute 2-hour rule like I normally would. And then catch kids being good. Make sure you're emphasizing the positive things that they're doing. And then if they're not doing so well, they have a lot of bad behavior, they're tantruming, try to find things that are creative to keep them busy. Try to find something new, creative every day, and it doesn't have to take a lot of time. But if they are being bad, I'll talk about tantrums a little bit, but redirecting that bad behavior into something that might be a little bit distracting or something good is always important to try. And then know when to ignore behavior. And the key thing here is never use physical punishment because that doesn't help the situation and can only make it worse. I want to talk now about the possible mental health changes. So we know that times of change, big stressors, are going to cause an impact on kids no matter what their age is. So that can be from anxiety and depression to maybe just the boredom. So there's a lot, each kid's going to experience this a little bit differently, but there can be anxiety, depression that comes up. Children may get a sense of loss of identity, and that's really important for parents to remember, because you may have a child who's a competitive gymnast and they are in the gym almost every day for hours on end, learning their craft and competing and winning awards. And that's who they are. And that's a huge part of their life. And all of a sudden they can't do that anymore. Or maybe they're a lacrosse player and they're in their senior year and this is the main thing they were looking forward to. So it's important to remember that and make sure that we're reinforcing the idea that that we are still there we're really there for our kids. We want our kids to be successful in lots of different things, and emphasizing that, like learning new skills during this time and things like that. But important to remember too that children mimic parents. So if you're feeling really anxious, your children might feel more anxious, and it's okay to feel anxious, but we want to try to maybe keep the news off and not expose them to too many things that will make them more anxious. And remember too that we need to try to be as positive as possible, and that doesn't mean you have to be happy all the time, but emphasizing the positive is important. For some kids, they may have improved mental health, like we talked about before. And then I have a slide here that just discusses signs of anxiety for kids that I'll touch on briefly. So for younger kids, they may show signs of anxiety by separation anxiety, tantrums, clinginess, regression of milestones like speech delay and toilet training, and maybe some sleep disturbances. And then for school-age kids, they tend to show it in more irritability, potentially aggressive behaviors. And then they complain about things like nightmares, stomach aches, headaches. They may not be eating as well, and they also can have sleep disturbances. And these things may get worse as time goes on. I know from my kids, after it's been a number of weeks, we're starting to see more of these things. So just keep that in mind. And then in terms of ways to help with the mental health changes, I did see in the Medical Minute, which is put out by Penn State, and this one was published on March 18th, there was some great information by Dr. Jessica Mattingly, who's a child and adolescent psychologist here at Penn State, who gave some really great recommendations. And I'll just go through a couple of them here, but let's make sure we're open to our kids' questions. They may want to know about the virus, and it's okay to talk about it and let them know what's going on in the world, but emphasizing safety, that we are being as safe as we can and we're safe at home. And we can say things like, most people who get the virus don't get very sick. Emphasize the family is safe at home. We're doing everything we can to be healthy. We're healthy here. We're safe here. We're washing our hands and those type of things. And then emphasize the skills of doctors, nurses, and scientists, that if we do get sick, there's a hospital nearby. There's lots of skilled doctors and nurses who would take care of us. And then validate children's feelings. Just let them know, yes, it's okay to be anxious. I'm anxious too, but we're here together. We're going to get through it. We're going to be fine. And then this slide is just to show you that a lot of this information and other information is on the AAP parenting website called healthychildren.org. It's a great website for both healthcare providers and for family members to get more information. And they have lots of COVID-19 articles that are very helpful. So I discussed that we would talk about screen time a little bit. And I think these are 6 good key topics to talk about with kids. I think the primary thing right now is to understand that screen time may be the child's only way to interact with their friends, and friends are important. They really are. They're sometimes the child's biggest support system, and they learn from each other how to be that age and what type of things are appropriate to say and do and what aren't. So it's important to keep kids connected, but you want to limit it somewhat. You want to make sure the kids are doing their homework, and you want to try to keep the cell phones and TV out of the bedroom, because you don't want kids to be on there late at night. They tend to sleep more poorly, and they have more difficulty just getting to sleep, and there's lots of other issues with that. But screen time obviously is something that can be helpful and something that can be hurtful overall. But try to also find phone-free zones. So maybe it's also eating meals together and not having your phone there. Don't let kids charge their cell phone next to their bed just so they can have it right by their heads. Give them an alarm clock, and that might be an easier way for them to set their alarm and not need their phone at night. And then I want to move on a little bit to how to deal with tantrums. So I want you to remember that it's okay to ignore tantrums. If the child's in a safe place and They are not going to hurt themselves by having the tantrum right there. It's okay to ignore. You want to try to distract as much as possible, offering small choices of different items, and that they like to have control. So offering choices is a very good method to do it. Move to a different room if you feel like you are getting upset, or you want to move that child to another room to have quiet time and calm down. Those are options. Stay consistent. Don't just give in to everything the child wants. And then take turns with other people. So you may not have a lot of people in your house right now to help out, but if there's another caregiver and you feel like you're getting upset and you would like someone else to come step in, that's an important thing to remember. And then the most important thing to realize, and what has helped me the most during this time, has been to realize that children are going through this too, and it's really hard. And reminding yourself that, especially in the moment where you're upset and your child's really not acting well, you want to remind yourself that it's hard. And sometimes all you need to do is just pick them up and give them a hug. And that may be the only thing they need. They may need attention in that moment. And now more than ever, I think that's an important thing to remember. And moving on to sort of having children home more and what that might lead to is just this idea of increased childhood accidents are likely to occur during this time. And that's a combination of parents working from home. Kids are home now. There may be fewer hands to help, and kids are getting bored. And we know that when kids are bored, they tend to act up more. So this can lead to more increased accidents. So I made a list of dangers in the home that you're probably well familiar with, but just reminders. And some of these are dangers that maybe you didn't think about, such as a hot fireplace, glass, or treadmill where a child can put their hand in the conveyor belt and potentially get injured. And then unstable furniture is a big one that I talk about with families, especially as children are able to crawl and walk. Once you have a climber and a crawler, they can tug on furniture and pull it down. So if you're sitting there working and you're paying attention to them, but maybe they move over to a piece of furniture and just pull it a stand really quickly and it comes down. So those are just key things to remember, trying to make your furniture and your house overall a nice, safe place for kids. And then additionally, we have a fear right now in the pediatric community of the increased risk of child abuse. And unfortunately, we have also seen decreased reports of child abuse. And I say unfortunately because we think that it is going on, but because our children are not in their safety net of their daycare providers and their teachers, there are less reports. And so it's difficult during social distancing to help determine when kids are not safe. So it's important for the community to be aware of what's going on with their neighbors and their friends and their families, and help report those things. And so that we can help children the best that we can. And there's a lot of efforts going on right now in Pennsylvania and all the other states to try to ensure that we're doing the best that we can to keep kids healthy and making sure that they're in a safe place. And if they're not, then we're getting them help. And so the reasons that we think that there may be increased risk of child abuse right now is that parental stress is heightened. Children are home more and they're getting bored and acting up more. And like we talked about, they're away from their safety net. So just some key things to remember. Now, ways to help. So checking on friends, families, and neighbors, offering support, and remembering that, of course, we're social distancing, but social distancing takes a back seat if we think a child might be in danger. So if you see it or suspect it, please report it. For the healthcare personnel, just some quick tips. Remember to ask parents how they are doing. So if you're seeing their child or you're seeing them for something else, just check in. How are you doing? They may reveal to you some things that might be concerning. But you also want to ask parents what type of consequences they use and give tips on healthy practices. Discuss ways to handle a crying baby and emphasize to never shake a baby, and ways to, calm that baby so that they're not getting too upset. Report if you are concerned about anything. So one last sort of small topic before we move on to questions and a case is just this idea of obesity being a possibly bigger concern after this pandemic is over, especially for kids since they're home from school. And I say obesity, but really I should say changes in weight, because some children may have food insecure family homes. And so they may have malnutrition. And so you may have the children who are snacking all the time, and then maybe the children who have to unfortunately skip meals. So it's important to remember both of those sides. But in terms of weight gain, we know that research has shown for children that they tend to gain more weight in the non-school months, such as the summer months. And this may be because school provides more healthy meals, or it could be that they're home and they're not as active and they're snacking a little bit more. But the months that are non-school months this year have essentially doubled. And so it's important to just realize that we need to make sure our kids are physically active and eating healthy during this time. So ideas to curb weight gain: use this time to try new healthy recipes and have fresh fruit and vegetables, if possible, washed and cut and ready to go in the fridge. So if you need a quick snack, you can just pull that out instead of something on the shelf that might be more calorie dense. We want to keep snacks out of reach of kids so they're not just constantly grabbing and snacking. And then try to not eat during TV time, keep TV time and meals separate so they're not overeating. And it's okay to say no to more snacks, especially if you know your child just had lunch. They may be bored. Try to distract them rather than giving a snack if you don't think they're truly hungry. And then let's ensure physical activity. And it's best if it's done with the family, because then that way we're setting good, healthy habits. We're bonding as a family, and it's more likely to stick that way as a healthy habit going forward. So in summary, children tend to have less severe illness with COVID-19. They tend to have less of the typical symptoms of COVID-19, but definitely more pediatric studies are needed and are ongoing at this time. Children may be impacted by the pandemic in other ways that affect the mind and body, and there are many ways to help children stay happy and healthy in the new normal. And I wanted to stop and just ask if there were any questions before I move on to a brief case.
Yes, thank you so much, Katie. That was a great presentation. I did get one question that came through chat. It was around when you were talking about the clinic and vaccination shortage. Someone had asked, will the financial burden on the offices affect the other aspects, such as how much financial aid the families can apply for? Do you know that answer?
So in terms of the financial aid, I would have to get back to you about that. I was previously in the military, and the financial aid is somewhat new to me, but I will definitely get back to you regarding that question. I know that we would not let financial issues be a hindrance to getting vaccines.
That's great. Any other questions from participants who have logged in, or comments from panel participants that are logged in? I did see there's a helpful resource created, Center for Children's Justice, just posted. If helpful, we're working with diverse partners to try and build a repository of prevention resources. And that person had included a Google Doc for folks to access.
Great, thank you. So I'll talk briefly about a case here. So we have a 14-year-old female with a history of mild anxiety at baseline, otherwise healthy. Her mother called for advice to the pediatric office about her poor sleep and increased anxiety. So her mother reports that she's having significant difficulty falling asleep. She's tossing and turning at nighttime. She's finally falling asleep maybe around 2 a.m. She's sleeping in late, waking up around 10 or 11 in the morning. She wakes up tired and groggy. She reports being on the cell phone late at night. And she tells her mom she's concerned she's going to die, but she can't really explain why. She denies any thoughts of hurting herself or hurting others. And she hasn't reported any bullying and denies any bullying going on. So I took this call as a telehealth visit, and I talked to both the mom and the 14-year-old girl. And I wasn't concerned about her hurting herself. You know, she says she's concerned she's going to die, and she can't really tell why. And this is pretty typical of this age, because a lot of times they have that anxiety and they're worried and they're having a difficult time maybe expressing why, but we think it's related to the virus and realizing that's in the community, and she's concerned about herself and her family. So basically, I recommended to try to get her sleep on a better schedule, because when your sleep is on a better schedule, your mental health tends to be better. And I wanted to ensure that she could be obviously as healthy as possible. So I encouraged mom to set limits on screen time, still allowing her to, of course, those strong connections with friends and family, but ensuring her structure during the weekdays is different than the weekends, if that helps her. And okay to sleep in on the weekends, but try to set her alarm in the morning to wake up at a reasonable time. And then help her connect to family and friends. Obviously, we talked about that already, but connecting with family and friends in positive ways, finding creative ways for family to interact with each other, and providing frequent reassurance to her that they were safe at home. And then obviously watch for and call back for any worsening symptoms. I offered some therapy options, and they wanted to wait until we were out of the pandemic and meet with somebody in person if any of her symptoms were worsened. But just a brief case, just to give you an idea of what maybe the teenagers are feeling and what sort of the things that are coming up in pediatric telehealth. These are my references. I really do want to emphasize the healthychildren.org website, where you can find lots of information about children and about dealing with different topics that come up during the pandemic. And then cdc.gov is a good resource for current numbers and things like that. And then I'd love to take any other questions if you have any.
Yes, feel free to ask any questions using the chat function, or you can unmute yourself and ask the group.
Hi, this is Melissa Tribuzio. I'm one of the pediatricians at Lime Spring Pediatrics in Lancaster. Katie, I think we met when you were in town.
We did, yes. Nice to hear from you again.
Good to hear from you. Hey, I have a question. I'm struggling with something professionally and personally, and I'd love some guidance from you and anybody else in the group this morning. I'm talking to a lot of parents and experiencing in my house as well some struggles with how to parent college students who are unexpectedly home, finding that balance between sort of respecting the normal ebb and flow of a college student's life and how that whole day is really phase shifted, but also trying to sort of keep your finger on if those phase shifts and behaviors are maybe an indication of some burgeoning depression or reactive disorder because of the situation, and also how that can play into disruption of how the family functions. Yeah, I have a college freshman home right now who his normal day would be staying up until 2 or 3 in the morning and then sleeping until 1 or 2 in the afternoon. And I'm struggling to find a place between where that's appropriate and respecting that that would be how his day would be if I wasn't around and he wasn't home, but also concerned about if that's really a healthy way to be approaching his life at this point, especially home in our house where we're getting up early to go to work, et cetera. So I'd love people's thoughts on finding that balance with college kids.
I think that's a great question. I think that the college age kids and the later adolescence is probably the hardest age right now to be experiencing this pandemic. And I think it's a really good question that would have a lot of differences depending on the individual child, and maybe what their baseline anxiety and depression is. And you as a mom would obviously know best when you feel like they are sort of getting worse and getting, more concerning signs of possible depression. And I think it's good to encourage those college age students to sort of do what they typically would do in school. And maybe that is his normal schedule. But if that's the case, then I would just keep track of, you just monitor signs and symptoms of anything that would be concerning to you as a parent and intervene if necessary, but encourage physical activity or whatever it is that would make your child happiest, whether it's, something that they do at home that's fun to do for them, or, that type of thing. But I think it's different for each child, and I'd love to hear from other people.
Does anyone else from the group have any comments to that question or thoughts? We do have another question in the chat function. What would be the youngest age that a child should wear a mask?
So we are recommending children above 2 wear a mask.
Okay. Anyone else have any questions or comments for the group, or maybe want to share their personal experience or things they've seen in clinic?
Hi, Ellie.
Yes.
Ellie, this is Cheryl Ryan. Hi.
Yeah, good.
I just wanted to, how are you?
Good.
I just wanted to respond to what I was saying, or the question, because I have a number of college age young adults. And I think some of the, what we're seeing is hard to distinguish between just reacting to losing a couple of months of their semester, not feeling like the summer's starting sooner and not having options for the summer. But some of the things that I think are real red flags beyond a real change in their sleeping. The sleep habits might be sort of what they do on the weekend, going to bed late and then getting up late. But I'm finding now with kids that I'm really worried about is if they're sleeping way beyond the length of time and they're not eating, because we've had a number of kids that have just really cut back on what they're eating. So I think if a teenager or a young adult is sleeping later, their schedule's off, which is similar to probably what they'd be doing on the weekends if they were in college or out from under their parents' observation or supervision, that would be okay. But if you're seeing things really, really isolation, not wanting to get out of bed, staying in their rooms a lot, and not eating, I think those are some of the red flags that that I've been seeing that have me really worried about maybe more than sort of the normal reaction, and maybe starting to worry about more significant depression. So those would be some of the red flags that I've been seeing and I'd be looking for.
I think that's a really great point, and I encourage you to, if you do see that with your patients, definitely try to find resources for them. There's a lot of therapists that are doing telehealth, and so they don't even need to leave the house for those resources. So I appreciate that response. Thank you.
We have another comment from Center for Children's Justice. If you want to unmute and maybe say that to the group, that would be great.
No, that's great. Thank you. I muted it first because I am one of those moms with kids running back and forth going, wait, I can't figure out how to get on my own Zoom classroom. But I just wondered whether or not you know of, or you could encourage like pediatric practices. Like, I just think this 30 minutes was a really nice reality check for folks without kind of hammering home, like, here's the bad stuff to do, here's the good stuff. And I just wonder if pediatric practices are inviting their practices, like sending a note out and saying, hey, look, we're gonna have a 30-minute conversation, jump on, and giving parents a chance who may not speak up, but may just take some of the information and kind of absorb it. I just found it a helpful, not too long, but a helpful presentation.
Thank you. One thing I've been doing recently is doing small topics on the local news.
Yeah, I've seen them.
And that way I've been able to sort of push out some of this information that way. But I think that's a really good point to send it out to your pediatric office, just some tips and guidance. I think that the parents are really looking at us as healthcare providers to give guidance, even on things that are just occurring at home.
Well, and even just the mask thing, you know, like obviously it's interesting because one element of the child abuse law is not to interfere with the breathing of a child. So like I may feel like the best thing for me to do as a mom of a, 14-month-old is to make sure they're all masked up and have the wrap around them or whatever. But just being told that and given that guidance, like we sometimes often see that injuries that happen to kids are really by very, very well-intentioned parents who just didn't know that was really not the best thing that they should do. And so maybe even taking this and making it available to pediatric practices, like if people don't have the bandwidth to do their own, be like, I don't know if it could be shared, but I was thinking that this morning we have this repository of information. Like, God, it'd be great for people to just tune in and see this like 30 minutes and be like, yeah, that's right. So thank you.
Yeah, absolutely. Yeah, I do plan to put together some of this information in sort of a PDF, and I could have that available as well that you could send out to the patient population if you'd like to.
That's great. And we'll put that on the participant shared resource folder. So at the end of the session, I'll make sure to put a link to that in the chat that you can access that folder and any information that we would put in there after the session. I do have a comment from Chelsea. Chelsea, are you able to unmute? So it looks like she's saying one concern she has that comes across her mind. Her friend works for an early intervention in Lancaster and York County, and she's being told that they may not be paid after May 2nd. So a lot of those children are not going to get those services. They encourage them to still service the families, even though they may not get paid, which definitely puts her in an awkward, unfortunate position. Any thoughts on that or additional comments or anyone experiencing something similar?
Oh, that's interesting. I haven't heard of this going on before now. And that is sad to hear because I find that those early intervention services are so important for kids. I do know that a lot of them are going to Zoom platforms to continue those services as much as possible. But if they're not able to continue the service at all, that is concerning to me. I'm hoping that since businesses will be open at some point in the future. I don't know when that's going to be, but I think that this is a temporary time, and I'm hoping that things will improve really soon. But in the meantime, there are ways that pediatricians can advise parents on things to do at home. So for those of you not familiar, early intervention is a service that's offered for children that are developmentally delayed and may have speech delay and other things. And so they're offered speech therapy, physical therapy, things like that. And those services are really important, but I think that parents can do things at home, such as the physical therapy that they've learned from their physical therapists that come to the home to instruct the child. The parents have also been watching and can do those things as well. So we're going to get through this, and nothing's going to be perfect, but once this pandemic is over, all these services that have not been continuing at the same pace are going to continue in normal operations again.
So it looks like Sarai, I'm sorry if I mispronounced your name, Santiago, has a question. Sarai, if you want to unmute.
Okay. Okay. Oh, hi.
Hi, I've unmuted you. You should be good to go.
No, good morning. My name is Katherine Santiago. I'm a CHW from New York City. And we just want to know, like, do you have any sources for children? Because I work with the pediatric side from the transition teams. So because next week we have a community advisory board meeting with the teams, and we just want to get some information.
I'm sorry, can you repeat one more time? What kind of
Huh?
information you would like, kind of like a PDF of the topics that we talked about? Is that what you're referring to, or a different kind of information?
Yeah, that's what we want to know. And yeah, basically, because I think it's hard for them to communicate with me or communicate with the social workers and anything. We told them all the time, if you guys need anything, you can hit us up. So we just
Okay.
wanted some sources for them so we can show it to them on the Zoom call that we might do with them.
Okay, so resources specifically for children, is that what you're referring to?
Yeah, referring to do for the pediatrics, the transition teams. They're from ages 14 to 21 in the sickle cell community. Yeah, I guess you guys were explaining the same things, that some of these kids were waking up late, doesn't want to do their homework. And I'll be like, I get that too, because I have a niece too that she wakes up late and she doesn't want to do homeworks either. I'm like, I get it.
Yeah, absolutely. When I put together the PDF that's designed for parents to help guide their children, or also put together maybe something that's designed more for teens to read themselves. I think that's a great idea.
Yeah, good idea for that.
And we'll make sure to have these slides in the participant resource folder as well. And of course, the YouTube video will be put up also. So you can certainly share that with anyone interested.
Okay, thank you so much. I appreciate it.
Yeah, thank you.
All right.
It looks like Jackie Vo has also shared some online resources for kids that can be incorporated into kids' schedules.
Great, thank you.
I do have a question here. Do you have recommendation for parents who find themselves getting schoolwork completed so fast, which leaves so much free time? And I can relate to that. I have a 10-year-old that seems to be done in about an hour. So it's a little difficult.
I can relate to that as well. I have a kindergartner, and it seems like the timing of the school is never perfect because either it's too short and you have the rest of the day that you have to be creative with, or it's too long and parents are having to sit there with their children and don't get their other stuff done. So I can definitely relate to that. But I don't want parents to worry too much about this time of the education disruption, because everyone's in the same boat. You know, your children are going to move on to the next grade level. They will have a couple months of things that maybe they didn't fully grasp, but the teachers are going to be really good about getting them caught up as much as possible. And like I said, everyone's on the same boat. So let's try not to worry so much. And the key thing is just getting through this pandemic as happy and healthy as we can. And I really want to emphasize the other skills that we can learn during this time. I think just my kids being home, I've noticed that we've learned a lot more just about life and about taking care of a house and riding a bike and things like that maybe we didn't focus on before, and just making those family memories too. I mean, those are going to be things that you remember. You're going to remember this time, and maybe it was because you made paper airplanes and flew it off the balcony and tried to see who the winner was, or whether it's some other little memory that you have. So just try to be positive and try not to worry so much about the education side of things. Do your best to help your kids learn as much as they can during this time, but you also have to be easy on them too, because they're not used to learning online or learning in front of a pre-recorded video of their teacher. It's just different for them. And so try not to get frustrated and just do your best.
Thank you so much. Anyone else have any questions or comments before we wrap up today's session?
Hi, this is Kim Alvaro. I was just saying, I put it into the chat box, but one thing that we've been doing to kind of disseminate some information to parents is using their their usual communication channels. So when we have maybe like this PDF that you've created, something like that, I send it to one of my contacts in the school district to be able to be included in some of the communication that goes out on their their Twitter feed and their Facebook page, because it's just one more place that parents might be looking for it and be able to get it. Sometimes they won't open an email from an email address they don't recognize, but if they're getting it from, the superintendent of schools, sometimes that's another avenue to go.
Great, that's a great idea. Thank you.
It's great feedback. We actually have a group here on Penn State College of Medicine's campus called Penn State Pro Wellness. We can certainly put that link in our resources document, but they do have access to schools, and Project ECHO also has access to a listserv that can reach schools throughout the state, but we can certainly kind of share this information for newsletters that might be going out to them in this time. Any other questions or comments this morning? Thank you so much for great discussion and engagement.
Thank you all.
Great. So just a reminder that you're able to collect CMEs for participating in today's session. A survey will be sent following the session, so please complete one survey for each session that you attend. You can use the same link for each submission. As mentioned earlier, all materials from today will be shared via email, and please consider submitting case discussion items, which can also include follow-up questions or items from today. Finally, we hope you'll join us for our next ECHO session scheduled for this Thursday at 9 a.m. The lecture and discussion will focus on healthcare response to intimate partner violence during the COVID-19 pandemic. And if you hold on here, I'm going to copy and paste the CME survey and access to resources in the chat function if you'd like to go to that now. So thank you so much.